Hello, everyone. Thank you for joining us for our webinar, Legacy Health Insurance Assistance Program, PrEP and You. Your health is so important, and that's why Legacy continues to not only provide great care, but to work to make care accessible and affordable for all. That's what this webinar is all about, providing you with information on the Legacy Health Insurance Assistance Program. It's a limited opportunity, so let's get started. But first, a few housekeeping notes. Only the speakers will have the ability to speak and be seen. Everyone else is off camera and microphone. We will have limited opportunities to answer your questions at the end of the webinar, so please submit your questions by using the chat feature. If we don't get to your question, we will work to answer questions in a frequently asked questions section that will be available on our website after the webinar. If you'd like to learn more about Legacy's Health Insurance Assistance Plan and/or PrEP, or schedule an appointment with one of our certified application counselors, please email pharmacymontrose@legacycommunityhealth.org, or you can call 713-814-3299. Now, I'd like to introduce you to our speakers, Gonzalo Estrada and Kenneth Jones, both of whom are pharmacists at Legacy Pharmacy Montrose and have helped many of our members learn about and access the many programs and services Legacy has to offer to help you optimize your health and wellness.
Thank you so much, Sandra, and welcome everybody. Again, my name is Gonzalo Estrada. I'm one of the pharmacists at Legacy Pharmacy. You might have seen me at the Montrose location, the Southwest location, or the location in Lyons. Thank you so much for tuning in as we talk about this limited opportunity to enroll in the health insurance marketplace.
And hello, everybody. My name is Kenneth Jones. I'm one of the pharmacists here at Legacy Community Health Montrose location. And I'm going to start off the webinar with just going over a few of the points that we want to touch in this presentation. First off, being an overview of exactly what the ACA is and the special enrollment period that's going on right now. Second would be going over Legacy's LIAP program that we have right now, and the benefits of you being enrolled in the marketplace with insurance and having LIAP, a timeline in which you have to get this completed, and how you can actually get started. So let's go over some of the basics. The first being what exactly is the ACA? You've probably heard of it before, more commonly known as the Affordable Care Act or Obamacare. This was placed into law in 2010 by Congress during the Obama presidency, and its whole purpose was to guarantee that the majority of Americans can receive or buy comprehensive, affordable health care in this country. And this special enrollment period that I referred to earlier was set forth by the Biden administration starting from February 15th of this year to August 15th of this year. And during this extended special enrollment period, you're able to sign up for a comprehensive and affordable healthcare coverage, which allows you to receive PrEP specifically, is what we're mostly here to talk about, but also other drugs as well too, and other healthcare services. And Legacy's role in all of this is that we are playing the facilitator in getting as many people as possible signed up for coverage through the marketplace right now. In addition to helping members enroll in this marketplace coverage, we're also extending this Legacy Insurance Assistance Program, LIAP, that I referred to earlier, which is great as well too. So LIAP will help patients basically get their PrEP for free, and through the combination of LIAP and being enrolled in the marketplace, your Legacy will pay for your premiums, your copays, and your deductibles on PrEP and other medications that you may need, as well as medical bills and any type of outpatient visits. So what are the benefits of being insured and enrolled in the LIAP program? Well, there are plenty. There's so many benefits of having that insurance policy through the marketplace. This opens up so many gates to receive quality healthcare. Not only will you be able to receive PrEP, but this will also cover you for visits outside of Legacy as well too. If you're experiencing an emergency and require hospitalization, most hospitals in the Houston and surrounding areas will accept this insurance as well too. And so we have a chart here that Sandra just pulled up.
Yeah, so this is a health insurance plan comparison chart. And we created it so that folks could look at it, and sometimes when you look at something versus when you hear something makes a bigger impact. And so clearly, if you look at all the benefits that are offered by signing up for the marketplace, I mean, it's comprehensive coverage. So it's obviously your regular outpatient provider visits. You have, as Kenneth mentioned, emergency access to emergency rooms, not just through the county hospitals. There's pregnancy, maternity, and newborn care that's also available. One that's really important, mental health and substance abuse disorder services. So that's a big one. Obviously prescription drugs, not just for your PrEP medicine, but for, if you have other illnesses that you are being treated for, labs, preventative, and rehab. So there's so many benefits when you sign up for the marketplace versus if you stay uninsured. And I mean, Gilead is awesome, but the only thing they offer is just medication coverage for your PrEP meds. So that's it. Like there's no hospitalization, there's no outpatient, there's no labs, nothing. So we just wanted to make sure that you were able to compare and see for yourself. Okay.
Great. So we've gone over what exactly insurance through the marketplace is and Legacy's LIAP program. Sounds great, but what exactly qualifies somebody to be enrolled in these programs?
Yeah, absolutely. So in order to qualify, you have to live in the United States. You have to be a U.S. citizen or a national or be living lawfully present. You cannot be incarcerated. You have to be uninsured and ineligible for any other third-party coverage. That includes like Medicaid or Medicare or any insurance through your provider. Through your employer. And you cannot be on any insurance plans like that are for your parents or your guardians, in other words.
Okay, great. So those were the requirements for the marketplace insurance, but what are the requirements for Legacy's insurance assistance program?
Yeah, absolutely. So for LIAP, you have to have an annual income of between $12,880 and $51,520 for a family of one. You can make between $17,240 and $68,960 for a family of two. I know those numbers are a lot to take in, but we have all of this up for you as well, so you can come back and reference it. An individual has to choose a Blue Cross Blue Shield silver level plan. You have to be a patient of Legacy's, and you have to be, we would require that you be adherent with your PrEP. So that means that you have to come to all of your provider visits. That includes your annual with your physician. And if you decide to do pharmacy PrEP, which Kenneth and I will touch on later, you would see one of the pharmacists like myself, Kenneth, or any of the others there once every 3 months. You would have to keep up with your lab visits, and most importantly, you have to take your PrEP medication every single month.
Okay, great. Sounds simple enough, but how exactly do people sign up for this?
Right. So luckily, there are quite a few ways to get signed up. So at Legacy, we're trying to make it as easy as possible. So we have a team that's actually dedicated to this. They're called the Certified Application Counselors. And what they'll do is actually walk you through the entire application process from start to finish. And they can actually get the application done on behalf of you. You can do this virtually or in person. What we want to stress is that we're here for you. So if it's easier for you to come in. If it's easier for you to get in contact with us over the internet, do that. So all you got to do to get started is you can just call us at 713-814-3299. Again, this phone number is going to be provided to you. You don't have to memorize it or write it down. And you can just schedule an appointment that way, or you can actually email us directly at pharmacymontrose@legacycommunityhealth.org for more information. Again, that's pharmacymontrose@legacycommunityhealth.org for more information. And then we'll be able to share again all of this with you at the end. So no need to write it down or memorize it. So once you've actually got your appointment settled, all you have to bring to your appointment is just your yearly income estimate, a list of your medications as up to date as possible, and your current providers as well. Again, we know that virtual appointments make it so much easier. It's so much more convenient as well. So we encourage and welcome that. But again, we're here to help. So if you prefer in person, we'll see you in person. For the virtual meetings, all you need is a smartphone or a tablet or a computer, just as long as you have access to the internet, really. And if you want, you can actually submit all of your documentation via a secure email at sep@legacycommunityhealth.org. So again, we're trying to make it as streamlined as possible. If you decide virtual route is for me, start to finish virtual, we'll get you taken care of.
Awesome. So after all that's done, what exactly happens after a person is enrolled in the marketplace with Blue Cross Blue Shield insurance?
Sure. So the team that I mentioned earlier, the certified application counselors, they'll have you review the welcome packet and sign a statement of understanding. So these will be either sent to you or signed to you electronically for easy reference. These two documents contain all the program information that you could possibly need, including program requirements, patient rights and responsibilities, as well as, this is probably the most important, who to contact and when. So there's really good information. Yeah. So the most important step after enrollment is just to submit your billing invoice or the electronic binder payment request to our insurance assistant team for payment processing. And again, you can submit that invoice electronically, and you would just submit that to insurance@legacycommunityhealth.org via email, or if you have a fax machine, you can fax it to 713-520-7520. The IAT, or the insurance assistance team, will send you, will send the payment within 48 hours of receiving your invoice. So your coverage usually takes about 72 hours to get activated once it's been received.
And, I have to interject, Gonzalo, sorry.
Sure. Yeah.
But I just want to stress the importance of submitting your invoice when you receive it. With Blue Cross Blue Shield, there's times that they'll send you a paper invoice, and there's times that they'll send you an electronic invoice. At any rate, whatever way that they get it to you, please, if you forward it to us, we'll take care of it immediately. But the one thing to keep in mind is the policy will only will not be active until the premium payment is made, which means you won't be able to use it for medications, for visits, or anything until that first premium payment is made. So that's why it is so important to submit that invoice as soon as you receive it. Let us, so we can take care of it for you. Sorry.
Oh, no, thank you so much. So on behalf of Legacy, we'd like to thank everyone for joining so you could learn about our Legacy Health Insurance Assistance Program and PrEP. We hope that this session was helpful and that we've given you all the information you need. To give us a call, shoot us an email. If you're actually at the location, then just come by, look for us, ask for us. We'll get you where you got to go so that we can get you registered. So I'll turn the controls back to Sandra in just a second. But actually, if you don't mind, Kenneth and I would like to talk a little bit about what pharmacy prep actually is.
Please, absolutely.
All right, awesome, wonderful. Okay, so like you said earlier, Kenneth and I are both pharmacists at Legacy, and we are some of the pharmacists who hold our PrEP visits. So what a PrEP visit is it's a sort of a follow-up to what your provider has initiated you on. So once every 3 months, you'll see one of the pharmacists for what we kind of try to sort of sell as like an expedited visit, right, Kenneth? We try to keep them about 30 minutes in length. Yeah, just so it's like you can come in on your off day, right? Monday through Friday, 8 to 5. We prefer Wednesdays, but we'll work around if you absolutely you can't make
and the first Saturday of every month as well too.
Yeah, exactly. First Saturday of every month, we'll have a pharmacist who can perform the PrEP visit there at the Montrose location. So just a real quick rundown. What we do is we get you in, we take some of your vitals. So we take your weight, we check your blood pressure, we run through some questions just to see a little bit of a follow-up of how your last 3 months have gone, to make sure that you're adherent, you're taking your medications. If there are any changes, then we need to address those. If you feel that you would like to get the rest of your panel done beyond the HIV test, then we go ahead and send you to labs as well, just to get all of that taken care of. We can do 2 separate types of swabs. We actually order a urinalysis as well. And again, this is in addition to the first rapid HIV test. Kenneth, do you want to tell us a little bit about how the HIV test is administered, how long it takes?
Yeah, so it's just a finger stick. Takes no more than about 5 minutes from the start of the process to getting the result. And I think one of the great things about doing the pharmacy prep is our accessibility. We're there all the time, and we have appointments throughout the day. So time is not really an issue for us, and we're very accessible as pharmacists. We're always there for you. You can literally just walk up to the counter and ask one of us too. So I think that's one of the great things about the pharmacy prep program.
I completely agree. I think that's something that, and again, this is done by design. It's not an accident. There's always at least one of us who can help you with a prep appointment. So even if you're coming in after you get off of work at 5:30, you rush in, you get there at 6 o'clock, someone there will be able to help you for the most part to get your appointment done, taken care of, so that we can make sure that you have your medication, because the last thing that we want is for you to have a break in therapy. We really, really want for you to have as close to perfect adherence as possible. We want you to have perfect adherence, but
yeah, and one of the important points to make, so these visits are every 3 months after you're referred to us by your provider, and once a year annually for a visit, you will be going back to your provider, but then starting after that visit, every 3 months back in with the pharmacy. So with that being said, you still have that one time a year or if there are any acute reasons for you to be to need an appointment, we can always schedule that, but you will always at least have once a year appointments with your provider just to go over anything that you would like to go over at that time.
Yeah, and so we're pharmacists, so we like to talk about side effects. So one thing that a lot of people ask us with when it comes to PrEP is side effects, right? Am I going to experience anything sort of crazy? What is my first week going to be like? Are my kidneys going to be okay? Is my liver going to be okay? So to address those things, many of the experiences that you have when you first start PrEP are what's called transient. So they go away after a few days, which could be like headache or upset stomach. In addition, if you're worried about your kidney health, we actually run BU and creatinine tests, which is just a big fancy way of saying we check to make sure that they're working okay. So at your visit, you have the option to do it at your 3 months, but we require it at the 6 month. And again, if you're curious about how your kidneys are doing well on this therapy, you let Kenneth or I know, and we send off the lab to make sure that everything's going well, so you have that peace of mind, and you know that not only am I protecting myself from HIV, I'm also protecting my renal health as well.
Awesome.
Great.
Awesome. This is really good information, even for me, and I appreciate it.
For sure. Yeah, and again, I just want to push something that Ken has said. Like, if you have any questions, your pharmacists, we're always there. So come in. Even if it goes beyond PrEP, if it's another medication that you're on, if it's something that you heard about new therapy or changing therapy, come in, talk to us, have a conversation with us. We'd be happy to help answer any questions. Vaccines as well. Pharmacists actually administer vaccines. So anybody who's sexually active, we recommend that you get your hepatitis B vaccine, which we can offer at the pharmacy. You don't need an appointment. We also recommend Gardasil, which is to protect against HPV, human papillomavirus, which can cause certain cancers. So it's really good to consider getting vaccinated at your PrEP visit as well.
Awesome.
Awesome.
So, do y'all have any more information on PrEP?
I think that's
and we could go on and on, I think. Yeah.
Well, this is why we want you to sign up for the marketplace.
Yeah.
So just to recap and want to go back to, we want to make sure that you leave with the information about the marketplace and how to enroll, and so that we can make these PrEP visits available to you, and in addition to any other healthcare needs that you might have beside PrEP. So in order to schedule an appointment, again, the phone number to call is 713-814-3299. Again, that's 713-814-3299. Or you can shoot us an email at pharmacymontrose@legacycommunityhealth.org. And with that, I think we're done.
Oh, I just remembered one more thing. Is that all right? Just 10 seconds?
Yes, yes, yes.
Yeah, okay.
10,
Hablamos
9.
español. Yeah. Si necesitan ayuda en español, aquí tenemos ayuda en español. Yo hablo español, hay otro farmacéutico que también habla en español. Si no hay alguien ahí que habla español, pues pueden mandar mensajes a nosotros y lo podemos ayudar, ¿ok?
Sí. Muchas gracias.
No, a usted, gracias.
Thank you.
Thank you, everyone.
Bye.